Most people don't stop to think about it, but our taxes provide 60% of the private insurance industry's income. So we as taxpayers already pay the lion's share of healthcare costs. In addition to Medicare and Medicaid, our taxes subsidize all medical deductions and taxes and the health insurance costs of every federal, state, county, and municipal employee, including Congress and the President, even though their plans are managed by private for-profit companies. So this already existing flow of tax money would simply be used toward paying for a single-payer system, where the administrative costs would take only 3 cents of every tax dollar instead of the current 23 cents per dollar. And we would not have to pay for investor profits or for maintaining billionaire CEOs. Well, this chart is for all the accountants in the room, so please bear with me. Okay, this line shows that our current spending on federal health care systems. Medicare and most other federal health programs are already government-run, so there wouldn't be any significant savings with a single-payer system. But the government employee programs would have a 20% administrative savings under single-payer, because these are currently paying private insurance companies to administer them. So we're already saving $22 billion from the total cost of all federal programs with single-payer. We'd also get a 20% administrative savings, amounting to about $145 billion on the cost of health care for everyone else who is currently covered by private insurance. Right now, this cost, $723 billion, is the amount we pay in premiums alone. For single-payer coverage, we wouldn't pay these premiums, and the government would need to collect only $579 billion to cover all of these people. Under single-payer, there wouldn't be any significant out-of-pocket costs, since the program provides comprehensive coverage. Now here we used a pessimistic projection to arrive at the cost of covering all the currently uninsured. This brings the total costs under single-payer to $1.992 trillion, as opposed to the current system's $2.4 trillion. So the savings under single-payer would be over $400 billion. Now what we've done here is subtract the existing taxes for health care shown in 2 slides back, because we're already paying for those. So that wouldn't change. They would simply be put towards paying for a single payer. And the bottom line shows that we need about $789 billion a year to completely pay for a program that covers everyone, including all those now uninsured. Well, you're probably going to ask me, where would we get that $789 billion? Actually, there are many ways that we can raise the money we need to cover everybody. And I'll just show you a few that won't hurt the middle class or the poor, and instead will legitimately pay us back some of the money that Wall Street stole from us as they led us into a recession. Here's the first way. Let's stop giving tax breaks to the wealthiest people in the country. That will raise $250 billion. The second is, let's make Wall Street pay back the hundreds of billions that they owe us. The total of NASDAQ and New York Stock Exchange transactions is $90 billion a day. So for a negligible 0.25% tax on stock and currency transactions, plus the lapse of the Bush tax cuts, well, that would almost cover everything we need. Here's an interesting one. Transactions on the foreign exchange market amount to $3 trillion a day. So a tax of only 0.1% will bring in $750 billion alone. This is not a new and revolutionary idea, but it's been around for a long time. Now, since we only need $789 billion to pay for our program, we would have a surplus using these 3 programs of more than $700 billion left over. And these transaction taxes are basically gambling taxes on the wealthiest speculators. The insurance industry and their allies spend hundreds of millions on ads and TV appearances to promote the myth that national health care can't possibly work. Well, of course they don't want a national health care program because it would take away their enormously profitable cash cow. They have invented a huge fairy tale about how dangerous single-payer is, even though we know that there are dozens of countries where it worked quite well. So let's go through some of the chapters of this big fairy tale. Well, Chapter 1. Won't our costs go up and our quality go down as our existing pool of doctors is swamped by 48 million new people? Well, compared to Europe, for instance, a lot of American money is wasted on urgent care, emergency room cases, surgeries that need to be done immediately because patients were not treated properly before. But when a patient visits the primary care doctor on a regular basis, the doctor can diagnose and treat conditions early. As a result, the patient can avoid those expensive operations and hospital stays. This kind of patient care frees up the doctor to make the appropriate choices for the patient early on, avoiding those last-minute life or death decisions and avoiding the risk of malpractice suits. The insurance industry claims that patients in single-payer countries have to wait a long time before they get to see the doctor, even longer to get the treatment that they need. Well, in some cases this might be true, but it's not because of the way the system is organized. The single-payer system that we're advocating does one thing and one thing only. It collects the money and it pays the medical bills. What does affect waiting time is how many doctors there are to support the number of people that need care, and that's a problem that we can solve by adopting proven methods used by the European single-payer countries. And as for the 48 million without any health insurance, their wait time is forever. Well, won't there be rationing of medical services for the same reasons? The truth, again, is exactly the opposite of this myth. Unlike the for-profit industry, a single-payer system can never deny anyone because of any condition, past or present. Currently, thousands of people are turned away by private insurers. Now, that's what I call rationing. Harry and Louise, whom you've seen on TV, are afraid they're going to lose their choice of doctors in the hospitals. But under private insurance, you have to find network doctors. By contrast, just like traditional Medicare, single payer gives you unlimited choice of any doctor or other provider at any time, anywhere in the country. Now, what about those government bureaucrats who are going to interfere or get in between you and your doctor? You may have seen Wendell Potter on TV recently. He's a guy who spent many years as a top-level executive in the for-profit health insurance industry before his conscience caused him to quit. He tells us that in the insurance companies, they hire thousands of people whose only function is to limit your treatment options or to deny your claim entirely. So your money is being used to pay people whose only job is to say no to your claims. It looks something like this.